good morning, good afternoon, good evening according to the time, wherever you may be watching me from. I'm your brother Stephen Oluwatuminino, and I shall be discussing with you on this platform some basic facts, some factors that have in great importance to us when it comes to our eyes and our general well-being. It is of great importance to realize the value of our sight, how to care for it, and how to adequately manage it when it comes to or when we identify any of the abnormalities or any associated signs and symptoms in our eyes. First and foremost, let's talk about the dangers, some identified signs and symptoms of the eye, which might indicate serious underlying conditions or that might be detrimental to our eyes or our general well-being. Because there are some systemic disease or underlying disease that we can easily that can easily be identified in our eyes. For example, cases like hypertension, diabetes, and so on and so forth. All these diseases or systemic diseases can be detrimental to our sight. In fact, there's what we call hypertensive retinopathy, diabetic retinopathy, and these are the systemic diseases which reflect in our sight. We have to talk of some dangers, just like I said, and some identified signs and symptoms that are associated with our eyes. For example, sudden or gradual loss of vision. When any one of us notices a sudden or gradual loss of vision, it's something that calls for, attention. Because when you are noticing sudden or gradual loss of vision, or we're losing our vision gradually, it is something that calls for an attention. Either we should go to a nearby hospital or to visit an eye specialist for an advice or for a prompt care. Some of us don't even know the parameter at which we are expected to see. As a normal human being with a good sight, we are expected to see at least with the parameter of